Something I aspire to in my role is listening to some of the more detailed feedback that we get from patients. Almost every organization, while they may not have a full patient journey conversion tracking system, in fact, almost none do, we all collect similar patient experience surveys, right? After a patient has an appointment, we ask them how it was, they give us feedback, we share those scores within the organization. Oftentimes, patients leave detailed comments. Many organizations have programs to say help train doctors or give feedback to staff. But some of those comments are really focused on their experience, their level of engagement. How easy was it to connect with my doctor? How easy was it to get my appointment? And I don't always know that in digital, we do a great job of incorporating some of that more granular feedback. We feel like we know better when it comes to delivering digital experiences. So something that I am working on with my team is bringing some of that feedback into our engagement measurement. As a leader of digital strategy, I would say my closest relationships, I have an amazingly close relationship with our marketing team and what we're doing on the campaign side. And when we think about lead generation and nurturing, et cetera. But some of my most important relationships are with our ambulatory operations leaders to say day to day, how are we functioning? How are we setting up physician schedules? What is our priority for getting patients in? How many new patients are we committing to see in a week? Or with our IT department to say, what does the experience look like from a tactical standpoint? What features are we prioritizing? So from that standpoint, something like the website, it lives in a space that is both marketing and digital experience, but without, for example, a throughput of operational cooperation, I cannot help patients make appointments available online. I cannot offer digital inventory without those supports. So those relationships and a cross-functional, healthy relationship across teams is the only way to be successful in digital. I have been really impressed with this organization in terms of its growth mentality. And I think we're in a really special era for the organization as it relates to that. For one thing, my experience in many health systems is that based on our DNA as a risk-averse industry, for good reason, because we're entrusted with people's health and well-being, for many new initiatives and innovations in the organization, the first answer is usually no. I'm starting with a no and I'm earning a yes. And that can be really important from a quality and safety standpoint, but sometimes be an inhibitor to change, to innovation, to trying new things, to moving forward with big projects. My experience here at UCI Health is that this is a yes organization, and the question becomes, yes, how? Yes, how are we going to do this safely? Yes, how are we going to do this at the quality of care that our patients expect? Yes, how are we going to do that with fewer or less consistent resources than we have ever had? And that is a really amazing place to be for someone and for a team focused on the consumer and delivering consumer experiences, since it's such a dynamic area of the healthcare experience.